Thank you very much, Mr. Chairman. So the bright idea in this proposal, this bill, is to pass a piece of legislation today that has the effect, according to objective experts, not to one party or the other, that has the effect of raising insurance premiums by 20% for those in the individual market over what it would be if this bill did not pass. The bright idea is to pass a bill today that will result in 14 million fewer Americans having health insurance. About 800,000 of those, by the way, are Texans. And about 5 million, we learned, though we got more questions today than answers, about 5 million of those are people that rely on the Children's Health Insurance Program or on Medicaid. As is so often the case in this committee, this is a measure to take from those in the 20 to 60,000 income range, the working poor, the folks that are struggling to get into the middle class or have just barely made it into the middle class, to take from them and to use it for other purposes. I think that is wrong. I think the gentleman from Georgia has it exactly right. It is wrong to pass a bill that has that effect, and that's what this bill is all about. They call it by a Washington name, Wreck-onciliation. That's close. But what it should be called is Wreck-onciliation, because it is a wreck for those 14 million families. It is a wreck for those children that have relied on the Children's Health Insurance Program, and it is a wreck for people that will be paying 20% higher insurance premiums than they would be if this bill were not passed. And of course, all of this is done in the name of repealing Obamacare, as if we had not been there before. With this, the 61st attempt to do that, I refer to these comments. At some point in time, you have to face reality. We tried to repeal Obamacare 50 some odd times in the House, and guess what? It didn't work. We probably should have figured that out after 2 or 3. Those are not the words of a Democrat. They are the words of our Republican colleague Mike Simpson of Idaho last week to Politico. But apparently in this committee, they haven't figured it out yet. As the chairman said, the goal here is to take apart Obamacare. Well, taking it apart has the effect of raising premiums and denying coverage. I've never thought that this law was as good as its detractors think it is bad. I think there are many things that need to be improved and strengthened in our health care law. But unfortunately, we've never been able to have an opportunity to come together to deal with any of those until last week when we got tax breaks for Tylenol. And that may or may not be a good step forward, but it certainly doesn't get at the core of one of the major omissions of this legislation. And that is the soaring price of prescription drugs. We need to have a full committee hearing on that subject. We heard recently about the impact of changing the cost overnight of one drug that was over 60 years old by 5,000%. An incredible increase. We have heard oncologists all over this country expressing concern about the fact that a diagnosis of cancer is not only a health diagnosis, it's a pocketbook diagnosis. It means you're probably going into bankruptcy in many cases, even if you have health insurance and drug coverage, because the cost of a regimen that might be $100,000 a year has an incredible effect. You see people mortgaging their homes. You see them going bankrupt and just hoping to be able to cling on to life for a short time longer. This impact, where in America we pay about twice the price of prescription drugs that most other developing countries pay, where we do not permit Medicare to negotiate prices for Medicare recipients, is wrong. And it is a major shortcoming in our healthcare system that this committee has some responsibility to address, and it has not addressed it. We could look at the shortcomings of the Affordable Care Act and see how we can do more to protect American families instead of denying coverage and raising the cost of health care, which this bill does. That would be progress. We ought to do it forthwith, and I yield back.
For the gentleman's